you. And I'm also a new member of the group. I joined during COVID, so I've never met anybody. If you look at Jackson County from a mile-high view, this is a great place for kids, and that's why I raised my family here. We have a well-educated population, we have good kids sports, good healthcare, arts, cultural activities, and a pretty good social support system. The community is vibrant, it's growing, there are opportunities here, so it's just a great place to be. The Annie E. Casey Foundation has rated Iowa as the 9th best state overall for children, so people from the outside agree. But if you delve into the details, some less idyllic situations come to life. With an eye to children's health care, we discover many who experience significant barriers in accessing care. They're sort of hidden in plain sight. This is despite the fact that we live in the shadow of the largest collection of pediatricians in the state. And there's more than 200 of us in the university. I think the biggest challenge that I see facing children in regards to healthcare is access to care. Access may seem really simple. You pick up the phone and call the doctor's office, or you log into your MyChart, or whatever your patient portal is, and schedule an appointment online. But it's actually a very complex system of accessing care. And it requires several essential elements. In order for a child to get scheduled to access care, there has to be a parent, there has to be a means of payment, there has to be a provider who accepts that payment, there has to be a provider who accepts the payment who actually has appointments available at dates and times that parents can go. You have to have English proficiency, you have to have transportation, and you have to have a certain level of health literacy or understanding of the system and also of your own body systems. Each essential element can actually become a barrier to accessing care. We all experience some barriers. There's long waits for certain specialties like rheumatology or mental health or and many others actually. There's treatments that are covered by your insurance, there's prior authorizations, all these things are frustrating. But the barriers are amplified many times for low to medium income families. My discussion will focus primarily on families earning less than $70,000 a year because this is considered the sustainable income for a family of 4 in Johnson County. It's pretty high, but that's what it takes to live here. So I'd like to look at how each essential element can impede access to care for kids. So the first essential element is a parent or a legal guardian. Not sitting makes it pretty obvious, but actually there are plenty of kids whose parent is out of the picture due to death, incarceration, drugs, mental illness, or some other reason. Often these children are taken into the care by another family member to avoid the foster care system. But many middle to low income families can actually afford to go through the legal process of getting legal guardianship. That's different than just guardianship, care of this child. There's actually a legal process. And the medical clinics and institutions in the community and all communities really require legal guardianship. So if you don't have legal guardianship, how do you take this child to the doctor? It's a problem. I've also run into, as you guys probably have a UAY as well, there are older teens who are still in high school whose families move away for some reason, and the kid is left here alone to finish high school, but they're usually less than 18, so they can't access health care because there's no adult to give consent for their care. Most kids can really fall through the cracks quickly. The second essential element is means of payment. So there are really 3 ways that people pay. There's private insurance, public insurance, or self-pay, cash out of pocket. Private insurance can be excellent or almost useless. So I have University of Iowa insurance, it's fantastic. I love my insurance, it covers everything. But I take care of plenty of patients who have private insurance, and yet they can barely use it because a lot of employers offer products with a very high deductible. It's it's well intended. It's to keep the premiums low enough that families can actually afford to purchase the insurance. But if you have a $5,000 deductible and you're a low-income wage earner, how are you ever going to meet your deductible? And you're basically a self-pay patient because you just can't afford to pay out of pocket to access health care. Public insurance in Iowa is actually pretty good. We have Medicaid that will cover families of 4 up to $44,000 a year worth of income. And we have the Supplemental Children's Health Insurance Program, which is the other government program that pays for health care for children. Each state has attached a little name that they apply for their supplemental program. Ours is Hawkeye. And that covers kids living in a family of 4 who earn up to $80,000 a year. So that's actually really pretty good. But Medicaid is cumbersome. Hawkeye's pretty darn good, but Medicaid is really cumbersome. Kids are often on and off of Medicaid several times during the year because unlike most private insurance where you may have to sign up once a year, people on Medicaid have to document and redocument their income all the time. And these are families that may not have their internet access, so it's hard to do it online. They often move frequently, and so they're not getting letters that are sent to a previous address. They don't return a document they're supposed to return, so they get kicked off. They reapply. But this is, I tried to, when I was a resident with a social worker, she made us apply for medication just to go through the process. It took me almost 2 hours to fill out the application, and I was a college-educated person. So if you don't speak English very well, or you don't read the greatest, it's a real challenge that we're asking people to go through. The other issue that we run into with all federal programs that have strict income limits is something called falling off the cliff. So if Hawkeye covers a family of 4 up to $80,000 a year, if you make $80,500 a year, you don't qualify. And it's not like you just get less benefit, you get 0 benefit. So you fell off the cliff. So we frequently see parents who will turn down a promotion or work part-time or refuse a raise because they can't lose the Medicaid. Because that $500 or $1,000 raise that they get isn't enough to buy the health insurance for their kids. The last group of people are self-pay patients. So in a lot of places around the U.S. and in a lot of counties in Iowa, there are federally subsidized clinics where people can go and get care on a sliding scale. These are called federally qualified health centers or community health centers, but Johnson County doesn't have any. So if you're paying cash and you can't afford to maybe go to a private doctor's office, then really your only options are the 2 free clinics in town, which are in Iowa City, free medical clinic for adults and healthy kids school clinic for kids. The third essential element for kids is having a provider who accepts your insurance. So many people are used to having to choose between a preferred panel of physicians. It's a little bit like that. But having insurance doesn't actually guarantee that anyone will accept your insurance. So if you have Medicaid and you live in a county where nobody takes Medicaid, then you don't have care. Where do you travel? Luckily in Johnson County, all the pediatricians and most of the family medicine doctors do accept Medicaid for medical care. Our big problem is dental care. There's one dental provider in all of Southeast Iowa who reliably accepts Medicaid, and that's the University of Iowa College of Dentistry. That's a huge problem. The other big problem that I've seen with Medicaid is mental health. The university accepts it, UNY accepts it. There are a few other providers that will accept Medicaid, but not nearly enough to cover the number of children that are covered by Medicaid. And lastly, there are a few insurances that are less common that are not well accepted in our county. One of the most important is TRICARE, which is the insurance that military dependents receive. Since we don't have a base around here, our providers are not used to accepting that insurance. They don't know how to work with it, and so they don't accept it. that's a small but real group of kids that can't access care. The fourth essential element is finding a provider who accepts your insurance but also has appointments available when you can go to them. The dental college appointments are about 6 months. Mental health for many clinics, I think right now is about 3 months. Sometimes it's longer than that. We have a new deficit right now, which is speech therapy. They're out 3 months. Our county has almost no primary care appointments available nights and weekends. My clinic, we do have clinic on nights and weekends, but it's mostly for sick kids. They're not welfare appointments. We have a lot of parents who are working in places, particularly Tyson's, but I'm not just picking on them, that's the one I know, where people work really long shifts. They work like 10-hour shifts, and they work 6 days a week. So there is truly no clinic open when they're off work that they can take their children to. Also, a lot of employers of low wage and low wage earners don't get personal days. So they have to use vacation time to take their kids to the doctor or to stay with their kid when they're homesick from school. And that's a big problem. I signed a lot of Family Medical Leave Act documents for parents so that at least they can get off of work without the risk of losing their job. They don't get paid for that day. And that for a lower middle income family, missing a day of work is a big deal. This is especially concerning for children who have complex medical needs because they have a lot of medical appointments and the parents can end up losing a really significant amount of work trying to get all their appointments. The next essential element is English fluency. Despite the fact that there are 80 languages spoken in the Iowa City Community School District, you have to speak English to make an appointment at almost every institution in this county. When I call Walgreens, I get a little menu right at the beginning that says, "Oh, prima el dos," you can push 2 for Spanish, but the University Hospital doesn't have that. I don't think Mercy has that. Practice offices don't have that. It's really hard to make an appointment if you don't speak English. The most common languages other than English that are spoken in our community are Spanish, Arabic, French, Swahili, and Mandarin. But few clinics even have staff who speak Spanish. It's hard to make or cancel an appointment if you don't speak English. It's hard to communicate during the appointment so that you can tell the provider your needs or understand what they're telling you to do about it. We do all have phone interpreters, but those are fraught with problems. The connections often have a lot of static in them, they cut in and out, and especially for Swahili, which is one of our most vulnerable populations in the Democratic Republic of Congo, refugees who speak Swahili. It's a very regional language. So if I have a patient in my office who is from Democratic Republic of Congo and the interpreter is from Kenya, they may not be able to communicate very well at all with each other. The sixth essential element is transportation. If you've got your insurance, you've got your provider, you've got your appointment, how do you get there? Many low-income families have no car. And many middle-income families have one car, and it's with the parent who's at work. So the parent at home has no transportation. Public buses, and Iowa City buses are handicap accessible, that's nice. But when you look at the routes, they really are focused on getting people downtown, particularly university students. A lot of the trailer courts and low-income neighborhoods in town don't have buses at all. And if they do, they come once an hour. And if you've had small children and tried to ride the bus, which I tried to do one day with my kids for fun, not for me, but one of them had a dirty diaper right as we were supposed to get on the bus. And so we didn't get on, and the next bus wasn't going to come for an hour, so we gave up. And that's what happens to people with their medical appointments too. Medicaid does pay for taxi cabs, which is great. It works really well for prearranged care because you have to reserve your ride 3 days ahead. So for well care or a scheduled follow-up, it's great. But if your kid is sick, it doesn't help you. In addition, in this post-COVID or later COVID era that we're in, whatever we're in, Everybody's short of workers, and the taxi companies are the same. So we've actually been told we can't even put a patient on the waiting list sometimes because they just don't have drivers. The other group of kids that have a lot of trouble with transportation are kids with complex healthcare needs who are wheelchair dependent or who are dependent on some other kind of equipment that has to go with them to appointments. And it's a real issue because one of those wheelchair conversion vans costs anywhere from $50,000 to $100,000. So if you're lower middle income or even middle class, upper middle class, that's a real stretch. There is Johnson County seats, but that has limited capacity as well. So that's another group that faces transportation issues. The last issue is, or essential element, is health literacy and cultural competence. This is a big problem for immigrants. So a lot of our immigrants from Central America and Africa have a really different understanding of health and treatment for health issues than we do in the United States. Spirituality and health are much more closely linked than they are in our culture, and there are all kinds of healers other than doctors that are involved in their care. Some immigrants that we're seeing in our county have very little formal education, and as a provider, it's very difficult through an interpreter on the fly to try to explain to someone who doesn't know what a virus is that that's what's causing their child's fever. And if you have a more complicated disease, it's even worse. We are getting some immigrants to the community now as well who don't read, even in their native language. So our practice in the U.S. of handing out written materials, it's very common at the hospital you get your after visit summary, your patient handout, they can't read them. In addition, a lot of families from Central and South America, as well as Africa, prefer to have oral instructions. You can give them something, they know how to read it, but they don't want to. They want to hear it directly from the doctor. So, those are really complicated. I do want to say that I think immigration status is a special challenge. 80% of my patients are Hispanic, and the fear of deportation is very real, and it interferes with accessing healthcare. It really came home to me during COVID when people knew that the COVID tests and the COVID treatment at University Hospital were free, and they still wouldn't go because they were afraid the hospital might turn them over to ICE. There's also a fear of using public services, even if you're eligible for them, because there was a rumor going around during the last administration that if you accessed any public services at all, that it would count against you when you were being considered for a green card. It was never true, but it has created an extreme fear. This is a really vulnerable population that it's a privilege to work with every day, and I think they do face some really significant challenges. So, in summary, in order to access care, kids have to have a parent, a means of payment, a provider who accepts it and has appointments. They need to speak English, they need transportation, and they have to have some sort of health literacy in order to be successful in their successful visit. As a community, what can we do to help? If you're inside the healthcare system, you can advocate for change. Websites and written materials should be in all languages that are significant within the community. There should be in-person interpretation, not phones. There should be social workers in every clinic. And these are things that my colleagues and I advocate for all the time within the hospital, but it's a slow change. If you're outside the healthcare system, keep track of the state legislature. And when you see something you don't like, tell your legislators. And the other thing is support donors, because they're in nonprofits and they